Hello everyone, my name is Daniel and I'm a nutritional therapist. And today I want to discuss nutrition for bone health. Today I'd like to talk about what we can do nutritionally to support optimal bone health and how we can try to reduce bone mineral density loss that occurs as we start to get a bit older. Osteoporosis affects about 200 million people worldwide, with about 10% of women over the age of 60 affected. As we age, we start to see an imbalance in osteoclast and osteoblast activity. Osteoclast cells are known for breaking bone tissue down, while osteoblasts are responsible for building bone. When we get this imbalance is when we start to experience a loss in bone mineral density. This can eventually lead to osteopenia and osteoporosis, which is going to greatly increase our risk of fractures. People at the greatest risk for lowered bone density are those at a lower body weight, excess alcohol consumption. Women tend to experience more osteoporosis than men. Also, we see increased risk in Caucasian and Asian populations, as well as any long-term steroid medication use, which is going to increase your risk of bone mineral density loss. Now I'd like to discuss some key nutrients that are necessary to support optimal bone health. The first one is obvious: calcium. Calcium is essential for building and maintaining strong bones and teeth. Now, calcium has many other functions in the body, which include blood clotting, transmission of nerve impulses, muscle contraction, and regulating heart rhythm. If we don't get enough calcium from our diet, our body will take the calcium from our bones for these additional functions. From this study, we can see that subjects who consume less milk during childhood and adolescence had a reduced bone mineral density and a greater risk for bone fractures in adulthood. Now, I'm not saying that we need to get all our calcium from milk, but this is a good indication that it is important to get the recommended amount, especially during our developing years. We can get calcium from dairy products like milk, cheese, or yogurt, small fish like sardines, figs, chia seeds. We can also find some calcium in vegetables like broccoli and cabbage, as well as in fortified foods like non-dairy milks. Next, we have vitamin D. Vitamin D assists with absorbing calcium in the gut. Insufficient vitamin D can result in softened or brittle bones and could eventually lead to conditions like rickets or osteomalacia. From this study, we can see that when elderly women with vitamin D deficiency were supplemented with calcium and vitamin D for 1 year, they demonstrated a significant increase in bone density. We can get some small amounts of vitamin D through our diet from foods like oily fish. However, we produce the majority of vitamin D as a result of sun exposure. So being outdoors in nature is a great way to top up our vitamin D levels. For those of us that live in climates where we don't get year-round sun, supplementation may be the best option. I always recommend to get your vitamin D levels tested prior to supplementation, which is relatively easy these days. Tests can be ordered online, or you can get them through your doctor. The next nutrient I want to discuss is vitamin K2. If calcium helps to build bones, and vitamin D helps to absorb the calcium that we eat, then vitamin K2 is needed to ensure the calcium that we absorb gets deposited within our bones and not left to calcify our tissues or blood vessels. We can see how a synergy of these key nutrients is needed to support bone health. This study aimed to measure the effect of supplementing with either calcium, vitamin D3, vitamin K2, or a combination of D3 and K2 on the bone mineral density of the lumbar spine of postmenopausal women with osteoporosis. As you can see from this graph, the group taking the combined K2 and D3 demonstrated the greatest increase in bone mineral density of the lumbar spine. Vitamin K2 can be found in fermented foods like sauerkraut and natto, as well as in cheese, egg yolks, liver, butter, and ground beef. Next, we have protein. Protein makes up about 50% of bone volume. Adequate dietary protein intake is associated with increased bone density. This study aimed to evaluate the relationship between protein intake and bone loss in the elderly. We can see that lowered protein intake was associated with increased bone mineral density loss. Finally, I want to discuss the importance of exercise. Strength and resistance training is one of the most effective ways to preserve or increase bone density. When we place an added stress on our bones in the form of exercise, our bodies adapt to this stress by increasing our bone strength. This study aimed to identify the impact of exercise on the occurrence of fall-related fractures. What they found was that exercise interventions resulted in a 40% reduction in the risk for fall-related fractures. In closing, I want to reinforce the point that when we think about bone health, we don't want to just focus on individual nutrients, but rather a synergy of nutrients and lifestyle factors that are going to support optimal bone health. Well, that's it for me. If you enjoyed the video, hit the like button, make sure to subscribe or follow, and I'll see you next time.